So this is vomer bone. This central bone is known as vomer bone, and the meeting area, the vomer bone superiorly connect to the sphenoid bone. This area is known as the spino-vomer junction. This part of the sphenoid bone is known as rostrum, and the margin of the vomer bone is known as alley of the vomer bone. So this area there will be two small canals. So it is very difficult to see. So here in this skull it is little visible. So these cracks having name. One is known as vomer vaginal canal and another is palato-vaginal canal. These two structure. This is lateral pterygoid plate. This is medial pterygoid plate. This is pterygoid humulus, and this is pyramidal process. This pterygoid plate and pyramidal process belong to palatine bone. Pterygoid plate will belong to sphenoid bone. In the midline we will have a bar-shaped bone. This bar-shaped bone, half is formed by sphenoid bone and posterior part is formed by occipital bone. This is the lateral aspect of the middle part. In the lateral aspect we will have sphenoid bone, and this is the continuation of ear. Continuation of ear is formed by temporal bone. Okay, so in between these two bones there will be a fissure. That fissure is known as sulcus tuberculi. This area will be occupied by eustachian tube, and this is the ear. Ear is covered by a plate called tympanic plate, and the medial most part is known as petrous plate of temporal bone, and between these two plates there will be a canal, there will be a depression. That depression is known as carotid canal. This petrous part of the temporal bone and the bar shaped bone meet together to form the foramen lacerum. One side sphenoid bone, one side the bar shaped bone, and one side the petrous part of the temporal bone. These three bones will join the foramen lacerum. Then we have this is the greater wing of sphenoid bone. This is foramen ovale, then foramen spinosum. Behind the spinosum we will have the spinous process of sphenoid bone. Then if we come posterior, we will have foramen magnum. In the side of foramen magnum we are having condyle. This condyle we are having posterior condylar canal and anterior condylar canal. And just anterior to the anterior condylar canal we are having jugular fossa. And the jugular fossa posteriorly limited by a elevation of bone. This elevation is known as jugular process.